Firstly, you must recognize that that same person inside a person with dementia. Dementia is just a disability, and the person has the same characteristics, the same interests, the same experiences in them. However, as dementia progresses, they will display some behavioral changes, because as it progresses, they will lose their social filters, and they will be very direct, maybe verbally or physically, and some perceive it as being difficult. That comes to our second tip. You must always diagnose what is that problem. Why is he displaying this responsive behavior? And there are a few reasons for this. It could be physical, meaning they cannot express their discomfort, and it's through their behavior they're telling you that they are uncomfortable. It could be cognitive decline. It can be psychological. There could be underlying reason like depression, anxiety, phobias. It could be environmental. The place could be too noisy, too much light. It might be somewhere that they don't feel comfortable in, too cold, too hot. And finally, it could be the action or the item itself that's causing them to be responsive. Either they are confused with what they see in front of them. And finally, the third most important tip is step into their reality. They do progress backwards into areas that you won't believe. An 80-year-old person may feel that they're only 25. Step into their reality, and when they talk about something in that era, live with them. Speak about it. Those are the 3 tips. Rejecting food, maybe ice cream or anything else, it is because it is physical discomfort, meaning that they've got a toothache or their dentures are hurting them. That's a physical part. Or if not, is it because they have lost the ability to do the motion of eating? And you could mimic it then and teach them again in front of them, eat together with them, so that they can see what you're doing. Or maybe they don't recognize what's in front of them. Example, we've got clients who've seen a plate of Hokkien mee in front of them, and they saw it as a plate of worms. So that can happen as well. So think back as to when she rejected food. That's when you call diagnosing a problem. As for eating ice cream, please, at this age, let them eat as much as they want. But if they have got diabetes, let's do it in moderation. Firstly, don't tell him off. Secondly, he's not retaliating. It could be 3 factors. If it was a mild and moderate dementia level, maybe he's forgotten the whole motion of going in for a shower, from the time of undressing through to putting on taps. Sometimes it helps a posters showing you the steps, or labeling all the taps with hot, cold. Now, if this person has gone to a different era though, and he's more advanced dementia, think of it, they have never seen a shower in their lives. They only know how to bathe the tong. They expect a bucket of water. So there's no way they know how to put on a tap and have a shower. And finally, it could be just no memory. He went into the shower, intending to shower, but he forgotten what he was going to do there. He started to wash his hands, forgotten what he was there for, walked out, saw a set of clothes. Oh, maybe I meant to just change. He just puts on his clothes and come out all dressed. So there are many reasons for it, but definitely it's not out of retaliation or not wanting to be hygienically clean. Nobody likes someone else putting their fingers into their mouths and prodding around. So imagine your mother who has dentures. Now, if it's mild, try and explain to her first before you put your fingers in. Explain what you're about to do. why you're doing it. Now, if this person has gone into a different era, she has no clue she has dentures. Those are all her real teeth. And when you try putting your hands in to pull out her dentures, she'll think you're removing her teeth, and she's going to bite you or keep her mouth shut. So again, diagnose the reason why she's doing this and try and understand from her perspective, and do it very gently and do it with care. And I'm sure she'll cooperate if you find the right way to do it.